Most people believe colon cancer always announces itself with severe pain and obvious symptoms. But that's one of the most dangerous myths you can believe. In many cases, the earliest warning signs are so subtle that people dismiss them as stress, aging, hemorrhoids, or simple digestive problems. And that's exactly why this disease can become so dangerous. By the time many people realize something is wrong, the cancer may already be much harder to treat. Your body often whispers before it starts screaming. Imagine a 52-year-old woman who notices occasional stomach discomfort. She assumes it's something she ate. A few months later, she notices unusual fatigue. Then she starts losing weight. She still doesn't think much about it. Nearly a year passes before she finally schedules an appointment. What she thought was a minor digestive issue turns out to be something far more serious. The frightening part is that many people have a similar story. Today, I'm approaching this topic as a senior health educator focused on awareness and early detection. This isn't about creating panic. It's about recognizing warning signs early enough to make better decisions. Your colon does much more than simply move waste through your body. It absorbs water, supports trillions of bacteria, processes nutrients, and plays a major role in digestion. When something interferes with that process, your body often sends signals. And here's something important to remember. Experiencing one of these symptoms does not automatically mean you have colon cancer. Many of these signs are caused by less serious conditions. But persistent symptoms should never be ignored. Let's begin with a symptom many people never connect to the colon: unusual fatigue. This isn't ordinary tiredness after a busy day. This is the kind of exhaustion that doesn't improve with rest. The hidden danger is that people often blame aging. They think, "I'm getting older. Of course I'm tired." But chronic fatigue can sometimes develop because slow internal bleeding gradually reduces your body's oxygen-carrying capacity. In some cases, fatigue may appear months before obvious digestive symptoms develop. Imagine someone who suddenly needs afternoon naps every day despite sleeping normally at night. That pattern deserves attention. Instead of assuming exhaustion is normal, ask your healthcare provider whether blood tests are appropriate. Evaluating iron levels and hemoglobin may help identify problems before they become more serious. The second warning sign is persistent abdominal discomfort. Many people expect severe pain, but early symptoms can be surprisingly mild. Pressure, cramping, aching, or unexplained discomfort can sometimes appear long before intense pain develops. The problem is that digestive discomfort is incredibly common. People blame spicy food, stress, medications, or indigestion, but discomfort that continues for weeks should never be automatically dismissed. Imagine someone who notices pressure in the lower abdomen every evening. They try antacids, change their diet, and wait for the problem to disappear. But several weeks later, nothing has changed. The better approach is to look for patterns. When did the discomfort begin? Is it getting worse? Is it affecting sleep or appetite? Tracking symptoms can provide valuable information during a medical evaluation. The third warning sign may actually appear in the toilet. Changes in stool shape can sometimes indicate that something inside the colon is altering the normal passage of waste. Many people never pay attention to stool appearance. Yet pencil-thin stools or persistent changes in shape may suggest narrowing inside the colon. Again, this doesn't automatically mean cancer, but it shouldn't be ignored. Suppose someone notices narrower stools for several weeks but feels perfectly healthy otherwise. Because there isn't any pain, they decide to wait. Unfortunately, waiting can sometimes delay diagnosis. The fourth warning sign is something many people overlook completely: loss of appetite. Food suddenly becomes less appealing. Meals become smaller. Favorite foods no longer seem attractive. The hidden problem is that appetite changes often happen gradually. A person may not even realize they're eating less until their clothes begin to fit differently. Unintentional weight loss combined with reduced appetite should always be evaluated. Think about someone who loses 15 pounds without changing their diet or exercise routine. That's not a symptom you should ignore. Rather than celebrating unexpected weight loss, ask why it's happening. The answer may be harmless, but unexplained changes deserve medical attention. The fifth warning sign is the constant feeling that you still need to use the bathroom, even after you've already gone. This sensation can become frustrating and surprisingly disruptive. People frequently confuse this symptom with hemorrhoids, constipation, or irritable bowel syndrome. But persistent feelings of incomplete emptying should never be automatically blamed on common digestive disorders. Imagine making repeated trips to the bathroom every day while still feeling uncomfortable afterward. If that pattern continues for several weeks, it's time to ask questions. Now let's talk about the most dangerous warning sign of all. Having no symptoms whatsoever. That's right. Colon cancer can sometimes develop quietly without producing obvious clues. That's why screening is so important. Waiting for symptoms can be a costly mistake. Screening allows doctors to identify abnormalities before cancer has an opportunity to spread. A colonoscopy doesn't simply detect cancer. It can also identify and remove polyps before they become cancerous. In other words, screening can function as both detection and prevention. And if the thought of a colonoscopy makes you uncomfortable, talk with your doctor about other screening options. Stool-based tests may be appropriate for some people. Family history changes the conversation. If close relatives have experienced colon cancer or certain intestinal diseases, screening recommendations may begin much earlier. Let me ask you something. If one of these symptoms lasted for an entire month, would you schedule an appointment immediately, or would you keep waiting? Leave your answer in the comments. Write down any symptoms you're experiencing. Keep a record of bowel changes, abdominal discomfort, appetite, weight, and energy levels. Details matter. And when you see your doctor, don't simply say, "I don't feel right." Explain exactly what's changing. When did it start? How often does it happen? Is it becoming more frequent? Here's the encouraging news. Colon cancer is one of the most preventable forms of cancer when it's detected early. That single fact should give you hope. Early detection changes outcomes. Many abnormalities can be treated before they become life-threatening. That's why awareness matters so much. Consider a retired teacher who finally scheduled a screening after months of unexplained fatigue. She expected doctors to tell her she needed more sleep. Instead, physicians discovered a precancerous growth during a routine examination and removed it immediately. She later admitted that postponing the appointment could have changed her future completely. Remember this, the body rarely betrays us without warning. The problem is that we often explain away the warnings until they become impossible to ignore. Let's review quickly. Persistent fatigue, abdominal discomfort, changes in stool shape, unexplained weight loss, reduced appetite, and feelings of incomplete bowel emptying should never be ignored. And don't forget the most important lesson. Colon cancer can sometimes develop silently. Never assume that feeling normal means everything is normal. You can't change your family history. You can't control every risk factor. But you can pay attention to your body. You can ask questions. And you can schedule screening. If this video helped you, type "Early detection saves lives" in the comments. And if you know someone over 40 who keeps postponing their screening, share this video with them. Don't wait until symptoms become severe. Protecting your health isn't about living in fear. It's about recognizing that one simple decision today may completely change your tomorrow. This video is intended for educational purposes only and should never replace professional medical advice. If you're experiencing persistent digestive symptoms, unexplained weight loss, blood in your stool, fatigue, or changes in bowel habits, consult your healthcare provider for an appropriate evaluation.